Welcome to our tutorial on mastering multiple-choice medical coding questions using the elimination technique. In this video, we'll explore how to effectively approach these questions to increase your chances of selecting the correct answer. Let's address a scenario involving an emergency tracheostomy performed on a patient with tracheal crushing injuries sustained in a motor vehicle collision. We're tasked with determining the appropriate CPT code for the procedure performed. Here's the question. The surgeon performs a neck incision close to the cricothyroid membrane to conduct an emergency tracheostomy on a patient who presents to the emergency department with tracheal crushing injuries sustained in a motor vehicle collision. Which CPT code should be documented for the tracheostomy? Here are the choices. Letter A, 31605. Letter B, 31610. Letter C, 31613. And letter D, 31603. At this point, you can put the video on pause to give yourself time to solve the scenario. Once you're done, hit that play button to see if you have correctly eliminated your way to the right answer. Go ahead. Ready with your answer? We're presented with 4 answer choices, each representing potential CPT codes for the procedure described. To determine the correct code, we'll employ the elimination technique. Our first step is to carefully review each answer choice and assess if it accurately reflects the procedure performed. Let's examine each choice systematically. Codes 31600 to 31614 capture incision procedures done on the trachea. Within this group of codes, 31600 to 31610 are used to report tracheostomies. The remaining codes, 31611 through 31614, talk about other incision procedures done on the trachea. In this scenario, it is clear that the surgeon conducted a tracheostomy on the patient in the emergency department. This information is the basis for our first elimination, as any code outside of the tracheostomy range would be incorrect. Code 31613, which is used to report tracheostoma revision as opposed to a tracheostomy procedure, is first to go. The remaining codes all represent tracheostomy procedures. Moreover, letter choice D and A actually pair up. Letter choice B, with code 31610, while still representing a tracheostomy, has the following code description. Tracheostomy, fenestration procedure with skin flaps. In this scenario, we do not find any mention of fenestration nor of the use of skin flaps. That being the case, letter choice B, 31610, is next to go. The last remaining choices, 31603 and 31605, both represent emergency tracheostomies. The difference lies in the words that follow the semicolon in code 31603. Any word or words after the semicolon in a CPT code description represent aspects of the service that are unique unto itself. In this particular case, 31603, while it is an emergency tracheostomy, is one where the approach is through the trachea or transtracheal. In this scenario, we do not find any mention of transtracheal nor or words that connote that approach. As such, last to be eliminated is letter D, 31603. The correct answer to this question is letter A. Code 31605 is described as tracheostomy, emergency procedure, cricothyroid membrane. And notice that the words cricothyroid membrane do appear in the question. By systematically evaluating each answer choice and eliminating those that do not accurately reflect the urgency and nature of the procedure performed, we can increase our likelihood of selecting the correct answer in multiple-choice medical coding questions. Thank you for watching our tutorial on mastering multiple-choice medical coding using the elimination technique. Stay tuned for more tips and strategies to excel in medical coding.